Kavita, you are on mute actually.
Oh, sorry. So, hi everyone. So, before going with the session, I would like to introduce myself. My name is Kavita. I'm from Ankura Hospital, and today I'll be your moderator. And I'm a fellow journeyer with you. So, I'm in this motherhood journey. So, I have a 1 year kid, and we all mom always worried about our kids' immunity. So we are worried about they are not having good immunity. We are not feeding we are not giving them a good food which full of immunity and all. So today we have our doctor, a pediatric immunologist and rheumatologist who gonna tell us all the questions and everything related to immunity for our kid. So we will wait for more 1 minute. As I said, 5 minutes we will wait. So we will wait for one more minute if we'll see if someone can join, and then we will start in 1 minute. And okay, so I'll start with the introduction of our doctor. So it's my pleasure to introduce Dr. Anjani, practices as a super specialty pediatric immunologist and rheumatologist at Ankura Hospital for Women and Children. And she did her MBBS and MD in pediatrics from the prestigious PGI Chandigarh, and obtained her DM in pediatric clinical immunology and rheumatology, same from the institute. So, and she is an expert in diagnosing and treating a wide range of immune system disorders in children, including autoinflammatory syndromes, juvenile arthritis, primary immune deficiencies, etc. And she focused on the comprehensive evaluation of and care for these immunological and rheumatological conditions. Dr. Anjali leaves no stone unturned in keeping herself updated about the latest advancements in treatments and technology for the benefit of her patients. And today she will answer all your questions related to the immunity for our little ones. So before we begin with our session, I request all to please, put your microphone on mute so that there won't be any disturbance in between the sessions. Over to you, ma'am.
Thank you, Kavita, for the kind introduction. Hello, everyone, all mothers there. It's a pleasure to meet you all. I'm also a mother of two beautiful daughters. I have a 6-month-old baby. So I also share the common questions which most of you might be asking me. So I'm a pediatric immunologist and rheumatologist. When we see children in our outpatient department, one of the most common questions asked to me by all the mothers or parents is my child's immunity low? Why is my child having recurrent fever? Why is he or she having repeated cough, cold? Are they growing good or is their immunity very low? And the most favorite question of all the parents here is kindly prescribe some medicine which can improve the immune system or boost their immunity. Before we try to answer some of these questions, let's understand first what is the immune system and what is the function of the immune system. We all are well aware that for us to be in a safe place in India, there is our defense which is constantly working at the borders. So we have our defense ministry which works with the army, navy, air force, and they continuously work at the borders to protect us from the invaders, protect us from the enemies, to protect us from the foreigners. So if they are not there, then it would not have been a safe place for us to live. So similarly, in human beings, we have a defense system. This defense system is the immune system, which will be constantly working with us to fight the enemies. So, what are the enemies for us as human beings? These majority are the infections. So every day our body fights off with these germs, infections, which can be bacteria, which can be virus, which can be fungi, which are constantly present in the surrounding environment. If it is these invaders, that is these destroying pathogens, if they enter the body, they result in infections. And the work of our immune system is to fight against these infections and send them out of our body. It is the immune system's work to keep our body healthy. If any defect in the immune system, then we are prone to develop severe infections. Either it is a severe viral infection, severe bacterial infection, disseminated fungal infection, any kind of severe infection can occur. So, what
I request everyone to please keep your microphone on mute, please.
So the next question is, what is immune system composed of? Is it a single organ? So we have liver, we have stomach, we have the brain. Is the immune system also like that? No. Immune system is comprises of various organs. All of them together work to protect us from various other infections. So what all are the different body parts which work to develop our immune system? The first and foremost, most important one is the bone marrow. So, all of us know we have bones. The inner part of the bones is called bone marrow. Bone marrow produces major cells in our body. These include red blood cells and the white blood cells. We all are aware that red blood cells are important for maintaining hemoglobin and the blood levels. Similarly, the white blood cells are the important fighters for our body. They are the main army for our immune system. These white blood cells are also produced from the bone marrow. There are different types of white blood cells, which are called T cells, B cells, and phagocytes. And each one has a different action to fight against different kinds of infections or pathogens. Apart from the blood and the bone marrow, there are other organs such as liver, spleen, lymph node, tonsils, thymus, etc. All these are also a part of our immune system. All mothers here are well aware of the organ which is called tonsils. Tonsils are present in the back of the throat. They are one of the important system for immune mechanism. They help in protecting the entrance of pathogens either into the lungs or into the digestive system. The WBCs which are present in the tonsils also help us in fighting the infection. There's another gland which is called thymus, which is present below the chest bone. This is a place where most of the white blood cells learn how to function, get matured, before they come into the blood and show their action. The other organs, like lymph nodes are tiny organs which are present in the armpits, sometimes in the neck and groin. These act like filters and remove the infections and pathogens. Similarly, liver and spleen are organs which are present in the abdomen. When the blood passes through these organs, they also act like filter and try to remove some infections. So defect in any of these can lead to low immunity. Any questions before we go further and have little more discussion? Any doubts in this part about the immune system? Okay. So the next thing is, when does this immune system start working? Is it from birth or as the child ages at 5 years, 10 years, 2 years? What is it? Right from the birth, every baby is born with the immune system. It is only with time that the immune system keeps on maturing. Newborns have low immune system, but by the time they grow, they get exposed to new organisms, pathogens, or infections. The immune system starts adapting to the environment, gets matured, and starts functioning completely. So the immune system, as I said, is present since birth. That means the immune system is predominantly regulated by the genes. So what are genes? So we all know every human being has his own DNA, his or her own DNA, and this DNA has lot of genes. These genes control every function of our body, from immune system to controlling how tall the child is, what is the characteristics of the child, are they going to develop any disease? All these are regulated by the genes. Similarly, the immune system is also predominantly regulated by these genes. These genes give us instructions. They give instruction to the immune system, whether how to work, what to work, at what level to work. And depending upon that, various cells, proteins are produced from the body. Apart from the genes, there are some environmental factors also which regulate the immune system. That is, the more exposed the child is with the infection in the early age, the immune system matures in a better way. So when these genes which regulate the immune system get affected, that is either they're defective, then what happens is these proteins, the cells, the WBC might not be working properly. They might not be in a good number to work properly. If at the border we do not have army, then definitely the foreigners, enemies can come easily into our country. Similarly, if the WBC, that is the white blood cells, are less in number, then any infection which is in the environment around us, that is, whether it is a simple viral infection or a bacterial infection or fungi which is present constantly around in the environment, can easily enter into the body and cause diseases in the form of recurrent pneumonias, recurrent cough, recurrent diarrheas. All these can happen. So any problem in the genes that control the immune system will lead to low immunity, and these group of disorders are called primary immunodeficiencies. I see a question here. Ma'am, some are saying that if mother feeding is not there to the kid doesn't have enough immunity. We will come to that point later. So, as I said, this group of diseases which are genetic diseases in which the immunity is low, and these are called primary immune deficiencies. So there are n number of primary immunodeficiencies. There are more than 400 diseases, but very few of us are aware of these diseases. We don't know that so many exist. It's not that these are rare. It is because of the low awareness. There are many children who are affected with these diseases. Once we are able to pick up these diseases, we will be able to treat them efficiently and they can lead a normal life like any other child. So let's see a case scenario. I think most of the mothers here would have this doubt. So last week, a child came to my OP. Mother was very apprehensive. He was a 3.5-year-old boy who has started to develop recurrent fever for the last 3-4 months. Along with fever, he has some running nose, intermittent cough, and cold. After some cough syrups, cold syrups, he immediately gets better and he is fine for the next 1 month. And again, he starts developing fever, cough, and cold. So, when I tried to examine him and ask further leads to the mother said in between the fever, he's totally fine. He's eating well, growing well, his appetite is good, and he didn't even need major drugs to control the infection. And he has just started going to school 2 to 3 months back. He was just put into a play school. So, this is a common scenario we face as mothers when a child starts going to school. When a child is exposed to a new infection, there is a chance that they develop frequent symptoms. So, in play schools, children play together in a close knitted environment. Suppose one child has fever, cough, cold, which could be a simple viral infection that gets transmitted to your child. Once your child gets better, there's a chance that the other child also gets the same symptom. After few days, as in a cycle, your child gets affected. That is the reason preschoolers, toddlers who are just put into school, who have just started to go into play school, develop recurrent fever, recurrent viral illnesses in the form of cough and cold. But do we need to worry for this part? No. You need not worry for them as long as the child is growing well, eating well. In between the fever spikes, child is doing good, happy, playful. He did not lose any weight and he didn't need any major medicines or admissions for these illnesses. You need not upfront worry. Do you think you need to test your child if he develops recurrent fever in such a scenario? No. If your child has just these symptoms and which respond quickly to minimal treatment and child is gaining weight and height normally and active, you need not investigate him for low immunity. Then the next question is, when do you test or when do you think the child has low immunity? So I see a question here. How many times in a year is normal for a child to fall sick? That's a very good question. So we are going there. So when do we need to think that the child is having low immunity and when do we need to test for him? There are some warning signs. It not only depends upon how many times the child is falling sick. It also depends upon in what way the child is falling sick. What is the infection the child is having? Was it a simple cough and cold which goes off spontaneously? Or is it a severe cough and cold which needs hospitalization, severe chest infection which needs oxygen support? These are some questions we need to answer. If your child has recurrent infections, that is, he or she is having the following infections, which I'm going to illustrate, then we need to definitely work them up for low immunity and decide the treatment. So what are these symptoms where we need to consider working up? If your child has recurrent ear discharge, that is ear discharge, pus coming out from the ear, which happens at least 2 to 4 times in a year. If your child is having recurrent sinusitis, that is in a year, he develops 2 episodes of sinus infections, then we need to consider that it could be because of low immunity. If your child has recurrent chest infections, he or she has developed cough, high-grade fever, difficulty in breathing, which needs oxygen support and which needs oxygen support, hospitalization, then we need to think that it is probably because of low immunity and it warrants immunodeficiency workup. Similarly, if your child develops repeated episodes of loose stools, one after the other, every month he starts developing loose stools. If your child is not gaining weight as expected, with some infection going around, that warrants immunodeficiency workup. If your child is developing pus collection anywhere in the body, be it in the skin, be it in any organ like liver, they need to be seen by pediatric immunologist. They need workup for low immunity. Suppose your child has repeated infections which are needing admissions, which are needing repeated use of antibiotics, which are needing injectable antibiotics, then that warrants workup for immunodeficiency because the suspicion for low immunity is very high in these cases. If your child also has some other manifestations like recurrent rashes, severe rash in the form of eczema, which is not responding to usual treatment. He is having some pus collections, which are called abscesses anywhere. That also warrants immunodeficiency workup. Most often, newborns and children around till 1 year of age, some of the mothers might have noticed a whitish coating in the mouth. That is called oral thrush. If it's lasting for a very short duration, we need not worry. But if the child is developing whitish plaque over the oral cavity, which is painful, difficult to remove, then it could be a marker for underlying fungal infection, and that warrants a immunodeficiency workup. And the most important thing, if anyone in the family, the brothers or sisters of your child, or anyone in the family, your brothers or sisters, also have low immunity or have repeated infections, or there is a death of any family member in the family, death secondary to an infection, then we also need to work up your child for low immunity. So the tests which we order for low immunity are varied. We need to assess the child, examine the child, and then decide what workup to be done. But what you need to remember in simple words is recurrent infections, severe infections, either requiring admissions, hospitalizations, infections which affect the chest, in the form of pneumonia, recurrent ear discharge, recurrent sinus infections, recurrent diarrhea, and pus collection anywhere are some pointers where we need to work them up for immunodeficiency. If a child was suffering frequently with cold and cough, what should the symptoms be? See, as I explained, a simple cold cough with no other major symptoms. The child in this scenario, in this epidemiological scenario, especially after COVID, when children have been constrained for up to 2 years, once they're exposed to the external environment, most of the children are developing these repeated viral infections, one after the other. But if these are just simple cold and cough, but not causing any chest infection, not causing ear discharge, not requiring IV antibiotics or any form of antibiotics, and the child is growing well, you need not worry for low immunity. That is just because of recurrent viral infections, which are simple infections. They are flu diseases, which you need not worry and panic and work up your child for immunodeficiency. I am just reading the next question. Same scenario happened with my child. He's 2 years old. Uh, Doctor said no need to worry, but is not going to play school and is active and loss of appetite at the time of fever in that case. How we need to consider that? Is it related to low immunity? So if your child is not going to school, sometimes 2 years, there might be another sibling at home who is going to school. They would be the focus for these or the source of viral infection in these children. Yes, appetite can be low during the episode of fever, but it should not be a low appetite for months or days together. Loss of appetite with cough and cold can happen for 2 to 3 days, maximum 1 week. Once the fever settles, the cough and cold settles, then automatically the appetite should improve and the child should be active. If this loss of appetite is chronic, like that is lasting for a month, 2 months, you see there's weight loss in the child, and again he's developing infection, then it is worrisome. I hope I answered your questions.
Do we have more questions? You can type. To all the mommies, and thank you, doctor, for the information and for the insightful session. So now we proceed with our Q&A, and I request all the mommies, if you have any doubt related to the immunity, please drop your questions so that doctor will answer all your questions here.
I see a question here. I have two kids, 3 and 1 year old. During the winters, they get pneumonia and causing them to admit in hospital. Is it because of low immunity? So if it is only happening during winter and if it is seasonal, then we need to look into other causes like allergic causes also, like asthma, hypersensitivity, air reactions can happen. There are hyperreactive airway disorders in children. So we need to first see whether that is pneumonia or an allergic reaction because of which the child is needing admission. So giving nebulizations is another thing. Many patients come and say, my child is admitted in the hospital. He responded with nebulizations and he is doing good. So children who respond only with nebulizations are probably not having pneumonia, or they might be having simple pneumonias like viral pneumonias. Children who are having asthma also respond to simple nebulization. If it is a severe pneumonia, usually the oxygen level in the body gets low and they need oxygen support. So if your child is needing oxygen support while admission, then we are definitive that that is secondary to pneumonia. Also, when your doctor orders some basic tests like chest x-ray when they have this lung infection, we can see that there will be some patch in the x-rays. If these also happen repeatedly, then also we need to work up them for recurrent pneumonia and low immunity.
Thank you, ma'am. It has happened for my 3+ years old kid. No, it's 3 times. Every winter, I need to admit him in hospital, and it's like they used to say it's a pneumonia.
Okay.
I don't know. Is there any preventive way to avoid this year? I'm just looking for. And the small one also is 1+years. Now he's in 2 winters. So 2 winters,
Okay.
I admitted him in hospital also. For
So
both
are
of
you
them.
definitely sure that's a pneumonia or something like hyperreactive airway disease? What do? They nebulize or give antibiotics?
They do both, ma'am. Antibiotic they are giving through IV fluids and nebulization also with oxygen they are giving.
Okay. No, nebulization with oxygen or continuous oxygen requirement?
So for one kid, it's like continuous oxygenation for 1 day, ma'am. And for
Okay.
another kid, it's just during the nebulization they provide with an oxygen.
Oxygen. So if there is oxygen requirement and it's happening yearly, then definitely we need to think about low immunity and see whether, and moreover, both the kids are affected. So I would suggest it's better we go ahead with the test to check how well their immunity is and then take a call. If they are well after the episode, if they're gaining weight, gaining height well, and are not having any other manifestations, then there is a less chance for it to be secondary to low immunity.
Okay.
And if we see the warning signs which have been proposed by the immunodeficiency foundations, they suggest if a child has 2 or more pneumonias in a year, they warrant immuno. There's no doubt that we have to work them up for immunodeficiency. But if a child is having only one episode in a year, then we have to assess him clinically, look how he is doing, examine his chest, look at his previous reports, and then take a call whether he actually has low immunity or not.
Okay, ma'am. Then I'll try to take an appointment with you, ma'am, during next week meeting. Thank
So,
you so much.
so before I answer the next questions, so many patients who come to me, they ask me one question. If I tell them these are recurrent viral fevers, just because the immune system is maturing, they need to adapt to the environment. They're getting exposed to new viruses in play school or from any other environment. Then they ask a simple thing to all the doctors, please kindly prescribe an immune booster so that my child doesn't develop these infections. Frankly speaking, there is no drug which acts as an immune booster. So there are some multivitamins which we can prescribe, but they are not actually immune boosters. They are just for the overall development of the whole body, but they are not going to target the immune system of your child. That is the reason I was trying to explain that immune system is predominantly regulated by the genes. So we cannot change the whole genetic makeup of a child after birth. So there is no drug which is going to work like a magic and increase immunity. So the next question comes, what else can we do to improve the immunity of our kids and what all we can do to keep our children healthy? Before that, I would again and again try to highlight that don't fall into the trap of immune boosters. Do not take over the counter immune boosters which have been portrayed as immune boosters, because there is no FDA drug approved for boosting immunity. So we have some natural methods with which we can boost our child's immunity. So one of our first question was, if we don't give our child breastfeed, will the child have low immunity? I would not say that if you don't breastfeed, 100% the immunity would be low, but the breastfeeding your child can add on and make the immune system much healthier. So they are natural boosters. So the natural boosters which we all can practice are, you should try to exclusively breastfeed your child for the first 6 months. So when the baby is in the womb, the mother's blood has antibodies. Okay, these are also proteins which fight against infection. These antibodies cross through the placenta and reach the baby in the womb. And these antibodies are present in your baby even after the birth up to 6 months of age. So, and slowly they decrease in quantity. At 6 months of age, your child's immunity keeps on maturing. So they don't need the antibodies from the mother. That is the time when the mother's antibodies disappear and the child antibodies start to function full-fledgedly. And some antibodies are also present in the breast milk. And there are good proteins which are present in the breast milk, good proteins, good fats, which help in fighting the infections. So how much ever you can, try to exclusively breastfeed your baby for the first 6 months. So what do we do after 6 months? You need to start complementary feeding. You need to ask your pediatrician regularly at the time of vaccination what feeds to give your child, because after 6 months the quality of the breast milk is not as good as it is and you cannot support the baby's nutrition exclusively with breastfeeds. So you have to start your child on solids. So, and coming to the toddler age group, once they're on complete solid foods, what are the superfoods which you can give? So again, the superfood is a myth. You should try to give a healthy, balanced food. So what is a healthy, balanced food? It should contain good amount of carbohydrates, very good amount of proteins, essential fats, and fruits and vegetables. So how do you manage in giving this to your child? When you prepare a meal, see that 25% of your meal that you offer your child should be of carbohydrates. And these carbohydrates should not be just processed rice. It could be any fiber rich carbohydrate. Then the next 25% should be in the form of protein, good protein, either meat, egg, or any kind of dal if you're a vegetarian. And the other 40 to 50% should be fruits and vegetables. So, which fruit, which vegetable, there is no restriction. The more colorful your plate is, the more vitamins, the all the minerals you are able to supplement your baby. So you have little rice, you have dal which is yellow in color, you have green leafy vegetables, you have some tomato, you have a fruit, mango, or any other fruit. The more colorful you try to make your child's plate, the more attractive it looks. And similarly, more nutrition also you will be able to give them. And one thing while doing all this, always remember, home cooked, warm food is the best food you can offer to your baby. Try to avoid processed food, junk food, and excessive sugars in your child. So these can be counterproductive. A good sleep can also increase your child's immunity. They should have exposed to fresh air. They should have good amount of activity. So activity in the sense, not just jumping, doing some physical activity. Many parents come and say, my child is always at home. He keeps running and doing so many other activities, but we don't take him outside, but he keeps falling sick. So keeping a child in a bubble environment for a long duration is also not good. They have to be exposed to fresh air. They have to go outside, get exposed to the various environmental triggers. Once you get exposed to these, then only your immune system will learn to fight with them. If you don't show them these infections, then your immune system doesn't even know that it has to fight with them. So subsequently, if at older age, suddenly they go out, then they fall sick. That is what has happened post COVID. For 2 years, most of the children were at home. So everyone were at home, no major infections. So once they started going to school, there is a sudden exposure of all these viral infections. That is the reason that most of the children started catching recurrent viral infections. So good breastfeeding, timely, appropriately starting solids, having a healthy, balanced diet, good activity, outdoor activities, exposure to fresh air, good sleep, and the most important thing is to give timely vaccinations. Consulting your pediatrician for timely vaccination is also important. So, how do these vaccines work? So, vaccines are also a safe way of exposing your child to infections. Vaccines are made by some body parts of these infections. They extract the body parts of these infections, make them into a safe way and stored, and then they are injected into our body. And our immune system starts working with these injections and try to increase the immunity. So, giving vaccines timely also helps us in fighting these infections. Can I'll just see the questions. I think I have answered the question that if the kid doesn't have enough immunity secondary to low breastfeeding, 3+ up. So I try to explain the simple form, what all food items to be included to improve your immunity. Healthy, balanced diet. Try to make your child's plate look colorful. Then he would receive all the essentials. As Indians, we always add spices, herbs, turmeric, nuts. These also have some component of immune boosters. These are all natural immune boosters. You will not give anything additional to your child. So till what age are these recurrent infections common? Till 4 years around, the immune system should be fully functional. Even after that age, if your child is developing this recurrent infection, then we need to think about low immunity and work up.
So ma'am, one next question is by Miss Harshini, that what foods needs to be avoided if kid is having adenoid problem, ma'am? How long it will last?
See, adenoid problem is not actually related to food. So increasing size of the adenoids could be because of varied reason. One among them could be secondary to allergies sometimes. Adenoids and tonsils, which can be allergic also. If your child is allergic to specific food, you need to avoid them. Otherwise, there is no single food which would trigger your child from developing adenoids. So, see, try to monitor the child of symptoms. You have given a food, then there is a worsening of symptoms, try to avoid that food. But just don't randomly avoid all food thinking that it may trigger the increase in size in adenoids. The next question is, my son always says he's getting pain in the leg. Is it due to some deficiency? Okay. So this is a completely different problem. So pains which occur in child, there are two types. As Ms. Sri Krishna said, Mr. Sri Krishna asked this question. So if your child is having pain in the bone or joints, especially in the morning, associated with early morning stiffness and swelling of joints, then we need to see for rheumatological diseases like arthritis. But like in this scenario, if your child is developing pain in the evening time, that is after activity, he has good activity, comes home and starts saying pain which is there in the lower limbs below the knee, and the pain reduces after a proper massage, then it could be a simple growing pain. But if the pains are occurring after the child sleeps in the night and he gets awake in the night and starts crying for bone pains, then it is something unusual and needs attention with the pediatrician immediately. But if your child is having these pains before sleep, after excessive activity, after excessive running, these are probably due to the growing pains and they reduce with compression and some massage. Sometimes vitamin D deficiency and calcium deficiency also can have manifestations like this, and they need treatment with that after evaluation. So Niharika has been asking that her child is 3 years old and he is hospitalized 4 times. Admitting 4 times is a lot more. So we definitely, and he also needed oxygen support and sometimes nebulization. So first we need to check his immunity, whether his immunity is low. If his immunity is low, what kind of immunity is low? Because there are 400 low immunity disorders. Depending upon the type of the disease, we will have to treat him. For some diseases, just giving medicines is enough. For some, injections are needed, and for some, higher treatment modalities are there. So we will decide depending upon the diagnosis. So here someone is asking about the kid not eating after the surgery. So I think we need to see what is the surgery, what was the reason the surgery done before knowing whether what is the management in him. So we need to see what surgery he is undergone. So it is nothing related to low immunity. Probably it is just a post surgery phase. You need to give your child some time, and please visit the surgeon if your child is not eating at all. We need to look into the causes. The next question is, my 4.5-year-old kid was hospitalized in January for scarlet, and she was on
Sorry,
antibiotics 5 days.
excuse me, ma'am.
Now after a month she started to lose lot of hair.
Hi, ma'am. This is Ramya.
Yeah.
Yeah, the I only question, ma'am. Surgery question is mine.
Yeah.
Yeah, ma'am. Can you please suggest any milk powder or anything for to gain weight, ma'am? He's not eating anything, ma'am. Actually, he had a cochlear implant surgery for hearing loss.
Okay, okay. See,
Yeah.
that is what I was trying to say. There is no immune booster to increase the immunity or in the same way weight. If he's not having food he used to have prior to the surgery and he's not having now, we just have to consult the doctor once. The other thing is any stress factor like surgery is a stress for children. So because of that, they need little time for adjusting, and that is the reason his appetite might have gone low. You be consistent in your food plans. Don't try to give something from outside. Recently, you all must have seen there's so many food products which have excessive sugar and so many other things which are not ideally to be put. So don't fall into the trap of adding a powder to the milk to just increase the appetite. What you have to concentrate is that even if you're giving a small amount of food, even if he's taking a small amount of food, it should be right food. It should have good amount of protein. It should have some fruit or vegetable. But don't try to just add some sugar and try to make your child chubby. Making your child healthy is important, not making your child gain weight.
Okay, ma'am.
Okay?
Thank you. Thank you. Thank you.
So, ma'am, another question is by Miss Vaishnavi. My child is premature born, now 4 years. She is frequently affected with viral infection, mostly cold. How can I improve her immune system?
I think we have answered. So it's the
And
same thing.
she is also having adenoid. How to cure it without surgery?
So see, adenoids, you always need not go for surgery. If it is allergic trigger adenoids in upfront, it would settle with the age and if you control the allergens. But if these adenoids are troublesome, they are causing difficulty in sleep, your child is having recurrent infections because of the adenoids and is needing recurrent antibiotics also because of the tonsils, adenoids, and the growth is not proper, and she is continuously having sleep disturbances, doing mouth breathing, then these are some indications that your child might need surgery to remove it. Otherwise, these adenoids have their own maturity system and over a time they would improve. But if that is the cause for recurrent infections, you need to consult your ENT and get the adenoids removed. My son is 4-year-old and he has tonsils and adenoids as per pediatrician. They met a ENT and they have removed the tonsils.
So he was advised to have his tonsils removed and adenoid removed. Prior to this, my child only had nighttime coughing. Should we get surgery now or wait and watch? And then she has also mentioned that my child had an allergy test because of his persistent cough, and the doctor advised us to avoid milk products as per test result. Please stop giving him milk after that. Do you know how long we should avoid milk products?
So the first question, I'm not clear. Have they removed the tonsils or
No,
not?
they have not. They have not removed. It is like
Okay.
just advised.
Okay, okay. So, the child had only nighttime. So now, see, that is what I was trying to say. If recurrent tonsillar infection is there, then you're giving your child repeatedly antibiotics. There's pus collection in the tonsils, and he's not growing well, and that itself is causing recurrent fever. Then definitely they need to be removed. But if it's only intermittent, like once in 6 months, every child can get tonsillitis. So if that is the scenario, you can definitely wait and watch. So previously there is as I was trying to explain what is immune system, tonsils are also a part of the immune system. So many get scared as whenever the ENT doctor tells them to get a tonsillectomy, many parents come and ask me whether it's a good option or not. So always you need to balance and see which is the predominant symptom. You need to see what is the risk and benefit ratio. If we feel that removing the tonsils, his infection frequency would reduce, or the tonsils are getting infected again and again, then definitely you have to follow the ENT advice. So initially, there was a thought that removing the tonsils would increase the risk of infections, would cause low immunity. There were multiple studies which were done on this part, whether they have studied children in whom tonsils were removed, and then they have checked their immune status. Initial studies showed that once the tonsils are removed, the antibodies are low in these children and they frequently fall sick and cause recurrent chest infection. But later, recent data suggests that there is no much negative impact on the immune system if the tonsils are removed when necessary. So we need to see the risk. We need to see which the benefits of removing. If your child is having recurrent tonsillitis, then and infections are because of the tonsils, then he may benefit from a tonsillectomy.
So another question is by Nivedita. So she is asking that by any chance newborn diet is increased suddenly more than what is required. Can this be a concern or anything related to immunity, or it is normal?
No, that's newborns do have growth spurts. Okay, their bodies are growing intermittently at different times. So generally at 4 weeks, 2 weeks, they have a growth spurt. Then at 4 weeks, then in few months, they have a growth spurt. So their demands are very high during that time. So usually babies demand more milk. If they breastfeed, sometimes they do cluster feeding. They during these growth spurts, they continuously want to be fed. And if they're bottle fed, also they would ask for milk more often. And your child is growing. As their weight improves, their demand and the amount of milk they need also increases. This is nothing related to low immunity. This is a sign that your baby is growing well. If they're demanding feed at good intervals, when they're having growth spurts, they will definitely have this increase in demand of feed. You should be happy and feed them. It's a phase, it would pass slowly once they get acclimatized.
Ma'am, actually, you skipped my question when other question was asked.
Okay. We are asking actually that Saujany's question is that 2-year-old kid sometimes doesn't put her feet totally on the floor while walking. Is there any symptom for any symptom for any underlying problem?
So is Saujanya here?
Yes,
Yeah.
yes, ma'am.
So she doesn't put her leg down at all?
No.
She does slow
Sometimes
walking?
if she's in a hurry or if she wants to run, sometimes she doesn't put and she forgets it. And sometimes if if she steps on any food or anything, she doesn't wipe it out. She just put her feet up and she'll run. That's it.
Okay, that you mean she walks on her toes?
Yes, ma'am.
Okay, so that is mostly habitual. The other thing we need to see is how is her development. So we need to see her ankle joint also for any contractures. But 2-year kid, it could be a habitual, a part of development, or some abnormality at the ankle. So we need to examine her and see and decide.
Yes, ma'am. And I also asked a question previously about my 4-year-old kid that was skipped. So I
Okay.
came.
What was the question?
she was attacked with scarlet fever on January,
Okay.
and we were admitted in Ankura Hospital, and she
Mhm.
was given antibiotics.
Okay.
And later on, she got cured, and doctor said us complete one bottle of Zincovit because she is not having proper, like, I don't know, but they gave us Zincovit. We completed it, but since 2 months, she's having a lot of hair loss. Even I don't have that much hair loss. She's having that much amount of hair loss, and now it is becoming little better. If I put oil, it is becoming more. If there is no oil to the hair, it is okay. What I observed, but we
Okay.
are almost going to complete second bottle of Zincovit also, but there is no like proper result.
Response. So, post-infect, so hair loss can be because of n number of reasons. One of the most common in children is post-infective. So
Okay.
post-infective, like even after typhoid or any severe illness, children tend to have hair loss. So like for example, for females, if you see after pregnancy, there would be hair loss. So
Yeah.
when the body recovers, even hair also has different phases of life. So during that time, like some hair shred, provided new hair is coming, you need not worry. There should be growth of baby hair also. If that is not there, you see lot of thinning of hair and there's still ongoing hair loss, then we need to see whether it is there multiple causes. Post infection is the one which if you improve the nutrition and after slowly after a month new hair will start coming. But if this loss continues to happen, first you need to get her hair checked by a dermatologist to see if the scalp is normal. After
Okay.
that, even after that, if this continuously happening, the other most common is thyroid related diseases. If once we rule out that, then we need to see if there is any underlying autoimmune related disorder and take a call. So as of now, you can wait. If it persists, meet a dermatologist, followed by thyroid related test. And if still persists, then definitely we need to look for autoimmune related etiologies.
Thank you so much, ma'am.
So, ma'am, another
Then
question is by Asma that his child is 3 years old and he has hypertonic adenoid running nose. While sleeping, he has difficulty in breathing since a month. What should be done for it?
hmm So I think if there is adenoid hypertrophy and as I said, if it's causing sleep disturbances, recurrent infections, you need to consult your ENT and depending upon the size of uh, obstruction, the adenoids cause airway obstruction. So depending upon the size and amount of obstruction, the ENT doctor will take a call on what to be done. So, what kind of nuts to be given to a 5-year-old child? You can give all nuts. You can give a mixture of nuts, like 5 to 10 nuts per day should suffice. There is no restriction. But if your child is allergic to, so if you're giving nuts to your child for the first time, you need to give one after the other. So, try almonds. Then the child is fine. Then you can go for the next nut and so on. But you have already given your child all the nuts prior and there are no allergies, you can mix all the nuts and 5 to 10 nuts per day should suffice.
Yeah, so others are thank you messages. Yeah, so one more question just we got. My child, this is asked by Gopinath. My child had an allergy test because of his persistent cough, and the doctor advised us to avoid milk product as per test result. We stopped giving him milk after that. Do you know how long we should avoid milk product?
So a few things I just want to highlight because a lot of people are asking about the allergy stuff. So low immunity, allergy and autoimmunity are three different things. Okay, so you all understood what low immunity is. The child is continuously exposed to infectious organisms and leads to severe infection. So autoimmunity is completely opposite. The immune system is hyperactive. So instead of causing or fighting against the infection, the immune system fights against our own body. That is how the name comes, autoimmune. Immune system is attacking us. So that release leads to development of autoimmune diseases. Then there is another group of disorders which are allergic disorders. These are totally distinct from low immunity diseases, autoimmune diseases. The allergic diseases are totally different. So allergic diseases are because of the hypersensitivity of our body. For someone, little excess of dust also doesn't cause any damage. For someone, just exposure, minimum exposure causes significant symptoms. That is because their body is hypersensitive to that thing. The same thing happens with food. Some are not allergic to any product, some are allergic to any product. That is why nuts are one of the food which are very much prone in triggering allergies. That is the reason I was trying to introduce nuts one after the other so that your child does not develop any allergies. So this allergic thing itself is a very complex thing. So we need to see whether actually the milk is the main cause for recurrent cough. So just a simple test might not tell whether it is the cause for allergy or not. You need to observe your child. If your child is developing symptoms after giving milk, if their symptoms are worsening after giving milk, and the symptoms get better once you keep the child milk free, then definitely it is because of allergy to milk. But if the symptoms are not improving even after you're stopping milk, then probably it is not related to the milk allergy and it is something beyond that. If it is related to the milk allergy, then a very prolonged duration of stopping milk is important. So we need to see all these factors before deciding whether it is actually milk allergy or not, and then only decide the treatment.
So I think, ma'am, you have answered all the questions which our participants has asked. So thank you, ma'am. It was really very insightful session and new things we came across and the terminology which of course is needed for we parents, ma'am. Thank you very much, ma'am.
Thank you, Kavita. Thank you all mothers. Bye.
Yeah. And thank you all mother for participating. If you have any topic which you want to hear from us, please DM us on our Insta page. Thank you. Thank you, everyone.